Welcome to Ideas in Action, the official University of Southern California podcast. This show was recorded live on USC's campus.
Hello, we're delighted to be here today to discuss Alzheimer's and caregiver health and well-being. I imagine that most of us gathered today have been touched by Alzheimer's and related dementias in some way. I know that's true for everyone here on this panel. It's perhaps one of the biggest undiscussed issues in our society today. Today, we're going to put the health of Alzheimer's caregivers front and center. These days, there's many terms to describe a family member who provides care, and we will be referring to care partners, caregivers, and family members interchangeably. The economic cost of dementias and Alzheimer's in the United States has been estimated at $305 billion last year, with nearly 14 million people in the US estimated to be living with dementia by 2060. But we're not here to talk today about the data. Instead, we'll have a conversation with two distinguished experts about what we know about the needs of care partners, what we don't know, and where we need to go from here. I'm Michelle Levander, Director of the USC Center for Health Journalism. Here at the center, we collaborate with journalists across the country to produce ambitious stories on health, healthcare, and health equity that have changed laws, policies, and sparked new community conversations. We're joined here by Dr. Laura Mosqueda, a professor of family medicine and geriatrics and a professor at the USC Leonard Davis School of Gerontology. She's the former dean of the Keck School of Medicine. And we're also so pleased to hear from Susan Howland, program director at Alzheimer's Association, California Southland. We'll hear a little bit from our panelists first, but we also want to hear from all of you in our audience. So please post your questions in the comments, and we'll include your questions and input into our half-hour conversation. Dr. Mosqueda, let's start with you. You have really built your own work as a practicing geriatrician and researcher on redefining the ways that geriatricians care for and serve people with dementia, most fundamentally by giving the caregiver or the care partner a role in the equation. Tell us how that is different and how that might play out in a given patient visit so we can understand how different this approach is.
Well, it's pretty different. Every time I'm seeing somebody, it might be we're making a new diagnosis, it might be a first visit or a follow-up visit, and they have a dementing illness like Alzheimer's disease. Really, the patient becomes my whole family. It isn't just that one person, it's everybody who loves them. Because one thing we know about this illness is that it does affect everybody who loves you. And so medically, we have to pay attention to not just the person who has the illness, but to the folks who surround that person. And so it means listening really to not only the person with dementia, who I always want to still have one-on-one time with, but also making sure I have time for that caregiver. And you mentioned earlier, Michelle, and Susan, I'd love to hear your view on this too, is like, there's care partner, there's caregiver, there's family member, all that. And sometimes what I see medically is early stages, you might be a care partner, but as things move along, you become much more of a caregiver.
But it's also a terminology that most people don't naturally gravitate towards. I'm not a caregiver, I'm not a care partner, I'm the spouse, I'm a daughter, I'm the neighbor. And so it's sometimes really awkward when we do talk about the caregiver or caregiver education or caregiver resources, like that's not for me. I'm just the spouse, or I just buy groceries once a week. So how do you work with families to actually identify that terminology or that labeling, or is it even necessary?
Well, and I love that point because I have to be careful about those terms and sort of check myself on those things. And also sometimes what I'm telling families is I want to give you an opportunity to be the daughter and instead of like being this full-time caregiver. And so it's also the language is a way to help talk about people's roles as well.
I think kind of one of the challenges I see when we interact with individuals through the Alzheimer's Association is that some of those individuals, regardless of their label, sometimes it's a sudden role for them, sometimes it's gradual. Sometimes it's chosen, sometimes there's nobody else and it's thrust upon them. Sometimes it's an honor and sometimes it's also a burden. So it's also really looking at some of those other kind of reasons or kind of the catalyst for that individual stepping into that role really kind of shapes that experience as well.
And let me ask both of you, as we think about this idea of elevating and acknowledging the role of the care partner, how much is our own healthcare system ready for that? And what might need to change to really value and include the caregiver more widely to fully help those who are living with these diseases?
We are not ready for this by any stretch of the imagination, and I think we're not ready for it in a practical sense of how a family becomes our patient, and some of the practical stuff is just how our offices are set up, how easily accessible we are to family members when they have something they need to run by us, billing codes, some of this really mundane stuff. So there's the practical piece, but then there's also the attitudinal piece too, I think, which is a real problem among people like myself, among physicians, healthcare providers, and offices, of how we're really going to embrace and make it an easy visit for everybody.
But you're right. I mean, and Dr. Mosqueda is, very unique and very kind of forward thinking and progressive. But, I still hear from families when the doctor's office calls and will only speak to the individual living with dementia to confirm an appointment. And, here is that wife or the adult daughter, whoever is that primary caregiver, saying, no, you need to talk to me. He'll agree to anything, but you need to talk to me. But it's still hard. They say, well, in the medical record, there's no place to note that, sorry. So it's a huge issue.
Yeah. And I'll tell you, just recently, I had a patient and a family member come in. They had an appointment and we're waiting and they're not there. And then this totally frazzled family member, care partner, caregiver, whatever you want to say, comes running up saying, I'm so sorry I'm late, but my dad won't get out of the car. He has Alzheimer's disease. He doesn't get it. He refuses to get out of the car. And, we just grabbed stuff and said, no problem, we'll do a car call. So we just went downstairs and I sat next to him and we did the visit in the car. And that's just the way you have to adapt sometimes. And instead of a caregiver, care partner who was really just frazzled and upset, we were able to sort of diffuse the situation for everybody, because she was really getting into an argument with her dad.
And it's normalizing those experiences. I maybe 25 years ago, I knew a geriatrician who had one patient who came for all of her, kind of regularly scheduled appointments, wearing a mink coat, which now is not very politically correct, but she'd wear a mink coat and nothing else. But for that office, that was fine because they somehow, that family was able to get her to the medical appointment on time. Or even now, it's a little bit different with the pandemic and virtual visits, but a lot of people, it's okay if you show up in your pajamas. Again, it's kind of also allowing that family member to understand that's okay. But also there's some certain norms within doctors' offices that, typically we don't go to see our physician wearing our pajamas or a mink coat with nothing else.
Yeah, and we know that people with demanding illnesses oftentimes won't remember kind of what happened, but they'll remember the emotion behind it. So we really will dance as fast as we can to have it be a happy, pleasant experience for the person with dementia at the doctor's office, so that they'll have hopefully good, happy memories associated with it for make it easier for coming back.
These examples that you're both giving in some ways might seem like small accommodations, but really they're quite revolutionary, because there are so many protocols of our healthcare system. Some of them are written into how we reimburse, but others are just the norms, the social norms of, you go to the doctor doesn't go to you, and so on. And so when you have somebody who can't so easily meet them, I can imagine a multitude of times where that person would just never get the person out of the car, or whatever the scenario might be, and the doctor wouldn't be willing. So these steps that really acknowledge humanity and the kind of challenges people have are huge. And I just want to commend you, Dr. Mosqueda, for advocating for that.
Oh, thank you. Yeah, we call it person-centered care, and we have this strong partnership with the Alzheimer's Association, who continues to teach me and our patients. Sometimes my prescription, instead of a medication, will be a prescription to the Alzheimer's Association or to an adult daycare program or something. But I think your point, Michelle, about really recognizing the humanity, we have such a tendency to depersonalize older adults, and then an older adult with dementia. They become others, they become non-human, and it's really important to always recognize there's a person across from us.
And I want to turn for a moment to you, Susan, because you have said that in your years of work with people with Alzheimer's and their families, you found that education is a top need for caregivers and care partners, and that they often find themselves in uncharted territory. So what should caregivers be exploring to equip themselves for what's ahead? What questions should they be asking? And how can they begin to prepare for this life change?
I think, the biggest challenge is none of us step into a caregiving role kind of with great awareness. Sometimes it's sudden, sometimes, like I said, there's nobody else. And we often still don't talk about Alzheimer's disease, despite the fact that it's increasing in prevalence. I go to the grocery store wearing my Alzheimer's Association t-shirt, and I can't get out of the cat food aisle because everyone's talking to me. But I think people just don't know enough that oftentimes they can't even ask questions. I mean, that's taking the assumption that there's a base level of knowledge and information to be able to formulate a question. So I think people need to understand what's going on in the present, whether that's changes in cognition, what are the warning signs, what does this diagnosis mean, and then a little bit more. So I always want people to be educated enough to put something on the radar. My one example is hallucinations are sometimes common with someone living in that middle stage of Alzheimer's disease. And there's a very different reaction from a caregiver who does not expect that. It's not on their radar.
I think Susan just froze, so maybe I'll jump in and pick up where she
in my mom's room at 2 a.m. and just, kind of talking to her kids, but it was the caregiver. So how do you put that caregiver enough education on their radar so they're not surprised and handle something with a little bit more calm rather than crisis? So something where it's like, oh my God, Mom, you're not going to be able to do that, is then going to upset her mom. And then that's just a situation that's going to start spiraling. So how do we give individuals enough information to enhance their skills and keep kind of calm?
And Susan, you froze briefly for a moment there. So we lost a part of that anecdote.
We want to be able to keep them as calm as possible, most definitely.
Yeah. And that's where I think we have a good opportunity to role model in the office too, so that it's not uncommon that I'll be talking to the person with dementia who I know can't give me accurate answers, but I'm just, saying, so, how are you doing? What'd you have for lunch today? And they'll give me an answer that's wrong. And if I see a family member who jumps in and starts correcting right away, it's a golden opportunity for me to go, hey, guess what? Doesn't matter if they have the wrong answer on that one. And then we can kind of talk about how to, as Susan just said, keep things calm. And in relation to what you were talking about with things like hallucinations, at my core, I'm a family physician. And one thing I learned about when I was doing more pediatrics was anticipatory guidance. When you see the 2-month-old, talk to the family about what it's going to be like at 4 months, et cetera. I apply the same concept of anticipatory guidance when I'm working with my patients and families who have a dementing illness. Like, we might be getting to a point where your mom won't be able to use a knife and fork very well. Let's just talk about what that's going to look like, and we'll talk about finger food. Or, it looks like we're getting on an edge where maybe there's going to be she's going to be seeing things that aren't really there, or hearing things that aren't really there. Let's talk about when that's really a problem and when it's just kind of weird, but we can deal with it. Because what I'm trying to do is avoid medication.
And in that vein, we have a question from our Facebook audience, which is, what documents should families get in place early in a diagnosis to better work with the family members' doctors?
So certainly, it's really important to have things in place like financial power of attorney and health power of attorney. Very often, families can anticipate when there's going to be, let's say, dissension, arguments, or maybe that one particular person who you know is going to feel more entitled than all of the other children. And one of the kindest things that somebody can do is have that really arranged and documented before things progress.
I think in addition to that, it's also one of the benefits of having that early diagnosis is that person living with the disease can also make decisions and share kind of philosophies on care and end of life. So again, if some of those decisions have already been made by that individual, it really eases some of that maybe kind of decision burden on the rest of the family as well.
Yeah, and I think that sometimes we focus on the documents, and really what I like to do is focus on the documents as a vehicle for a conversation. So yes, it's important to get things signed, et cetera. But one thing the documents do is kind of help get a conversation going that's really, really important.
Definitely. And then the one thing I do have to advocate for, because this is focusing on caregivers, is that I do talk to family members who are that primary caregiver, usually that spouse, and say, well, are all the financial and, legal documents in place? And it's like, yes. Well, okay, who is your proxy? Well, my husband. Well, your husband's in mid-stage Alzheimer's. So I think it's time for you to go back and revisit your documents as well.
So we're about halfway through our Facebook chat, and I wanted to follow up on something, Dr. Mosqueda, that you said about, the kind of behavior that you try to model for something that might seem startling or incorrect. What broad advice do you have for care partners or caregivers about those kind of situations?
Well, a couple things. One is oftentimes if you start to act anxious, your loved one will also start to act anxious. So thinking of yourself a little bit like an emotional mirror. If you're able to calm yourself down, and we talk about breathing techniques or other sorts of methods, then the person might respond also by calming down. Sometimes people just really end up radiating off each other. The person with Alzheimer's says something weird, and then the care partner kind of scolds them, and then they start ending up in an argument. One thing I can pretty much guarantee is you will always lose the argument as a caregiver. You're trying to reason with somebody who might not be reasonable, and that just never goes well. So very few things are so important that you have to be right or that things have to be corrected. I think this helps us be better people in general, actually, which is, taking a breath and going, well, that one was weird. But I'm just going to let it go because it really isn't that important. So showing people how not to correct, not to argue, but to be accepting. And the other thing I'll mention that's pretty practical is sometimes when you see somebody beginning to get upset, we teach caregivers not to respond directly to the issue. I want to go home. I want to go home. I want to go home. And saying, Mom, you are home isn't the way to go. But giving a hug and a kiss and reassuring and saying, I love you so much, that's a great way to go, because that's home. Feeling reassured, feeling centered, calm, and that you're loved, that's home.
And I think absolutely brilliant points, absolutely correct. But I think it's also a challenge for family members because they are unlearning sometimes 40, 50, 60, 70 years of learned behavior in terms of how to interact with, say, a spouse or a parent. And it really is unlearning and, kind of developing new communication skills, new ways of kind of relating to one another. So it's really is as much as it seems easy, when my spouse is saying I need to go home, saying, "Oh, let me give you a hug." It is behavior and changes that are difficult for the average person to make, and really need that support and modeling and encouragement to be able to kind of continue with those changes and evolution.
Yeah, and that's why I think support groups and books and all that are so important, because it's not intuitive. Like, you wouldn't know to do that. So I still remember vividly a house call I was on with a couple, and they were both close to 90 years old, and they'd been married for over 60 years. And it's exactly what Susan said. His wife had Alzheimer's and was pretty well into it by the time I met them. And he kept wanting to incorporate her in because she was the glue, and she was the one who did all the social calendaring and all this sort of stuff. And, this is a huge loss for him in so many different ways, when they were used to really being a very equal couple. Yeah. And now the dynamic was changing. That's something you have to work through.
Yeah. And question that follows, dovetails nicely with this from one of our Facebook audience members, which is, what are some strategies for engaging in casual conversation with someone with Alzheimer's in ways that are pleasant and don't emphasize their memory loss?
Tell me about, let's do something that might also not be casual conversation, but an activity. Let's go watch birds. Let's go do a jigsaw puzzle. I mean, there are ways to engage in somebody where it doesn't always have to be communication. But I do think it's pretty common for people to fall back into that habit of, well, I told you, don't you remember? So how can we try to eliminate some of those words? But again, it's finding common, there are lots of common activities that we can do together. And if it is a conversation, say it needs to be on the phone or through Zoom, who cares what the answer is? So, what did you have for lunch today? Well, I had a peanut butter and jelly sandwich. Oh, that must be delicious. I love peanut butter and jelly sandwiches. So again, not insisting on the being right, but to have that interaction is the positive piece, and to have that nice, calm demeanor reflect the positive emotions, And I think the other thing I need to kind of insert is what we say and our body language are sometimes two different things. Think about, if I were to say to you, "Oh, no, I'm not mad at all," is very different than "I'm not mad." So we need to make sure family members are really aware of body language, tone, volume. And sometimes that's more important than what we actually say, what our words are.
Those are such great suggestions. And Dr. Mosqueda, you mentioned two things, reading books, and you also mentioned this idea of your days harkening back to your family practice, and this idea that you would tell somebody for their 2-month-old what to expect at 4 months. So what is for both of you, what to expect in your first year equivalent books that you all would recommend for people?
It really depends on what stage. Sometimes people are bringing a loved one in to see me for the first visit, and they're already years into a dementing illness, and sometimes it's very, very early. So it really depends on where they are in the process of the illness. And then also it's meeting people where they're at. Like, what do people understand will help guide me. So it's very much of a partnership between the healthcare provider and the patient and the family to figure all this out. So I often will start by asking a question. So, if I'm providing a new diagnosis of, let's say, we think this is Alzheimer's disease, and we sit down and say, this is what I think, and this is what this is why. What I'm then going to want to elicit from the family is, what do you know about this? So how are they reacting? And they're like, yeah, we figured that was going to be it, or what's going on? And reminding them, just remember now, your dad is the same guy who walked in. So the fact that we've now put a label doesn't make him different when you walk out, but let's talk about it. And what I want to know is, what do you know about this? Because sometimes people have what are probable misconceptions that we can help start working with, and kind of understanding where they're at. And then the other important piece is understanding what their relationship already is. because I might be seeing somebody who seems like a lovely person who now does have a dementia, and we have a daughter who seems like she's going to be caregiving. But once I explore their relationship, I find out that he used to be an abusive father. And so I need to understand that so that I can help prevent her from becoming an abusive daughter, and also help figure out, is this the best caregiving situation? And I'm sorry, Michelle, I don't know if I answered your question.
Oh, it was about books that you would recommend.
Oh, boy, it didn't even come close, did I? So I like a book called The Best Friends Approach to Alzheimer's, is one of my favorite books. And sometimes I don't think you necessarily need to read books about dementia, but even novels where there are people with dementia in them. There's lots of different ways to learn about dementia and memory loss.
And I'd say dosing is really important for that caregiver as well. So, one book that has been historically popular is The 36-Hour Day. And I will have people who kind of read a couple pages, over the journey of Alzheimer's disease. And then there are other people who sit down and read the whole thing in one day. So for those people, it might be beneficial. I've had other people who read a little too much into the 36-hour day and look almost traumatized after the fact. So it's really dosing. What is the correct dose of information for that person? Not only to be able to kind of emotionally process it, but absorb that knowledge as well and the skills.
Yeah, and then reliable websites like the Alzheimer's Association, Family Caregiver Alliance have good, valid, reliable information too.
Yeah.
And Dr. Mosqueda, you've talked about how in our popular culture, the caregiver often becomes a bit of a caricature, either portrayed as a selfless saint or as evil and neglectful, when the truth is really somewhere in between. So taking care of a family member is enormously stressful. Why is it important to recognize all of the needs and aspects of a care partner in a way that's more realistic and pragmatic?
Yeah, because we're all human. And we all have prior relationships with that care partner that come into play. As Susan said earlier, for some people, it's an honor to take care of a loved one. For other people, it's a drag for a whole variety of reasons. Maybe having to do with their prior relationship. So and then there's everything in between. So I think giving caregivers permission to not have to be saints and saying, you know what, this is tough. There is really nothing in life that prepares anybody to do this job. How are you doing? And sometimes it'll be practical, really practical thing, like how do I turn somebody, or how do I help feed them? And sometimes it's more emotional of how do I react when they do X, Y, or Z. But really understanding and explaining to them that we all go through ups and downs and have good days and bad days, and that's okay. And I want to talk. I want to hear how it's going for you. The last thing I'll mention about this, because I think it's extremely important, is we know that people who have have a dementing illness like Alzheimer's have a 50-50 chance of being abused at some point during their illness. And that's a strong word to use. I understand that. And it could be financial, it could be emotional, it could be physical, but all of us can potentially take it out on somebody. And it really is never okay. So helping caregivers recognize this at early stages when stress levels are beginning to climb, and we can help decompress, is critically important.
I think all of us can relate to being a caregiver, supporting somebody while they have the flu, or perhaps, recovering from a knee surgery. But that's very time limited, especially kind of looking at this journey of Alzheimer's disease, which, I've seen caregivers who have been providing care for 2 years. I've seen caregivers providing care for 22 years. And that's an awfully long time for somebody to try to be perfect, to try to put the needs of someone else above themselves without addressing their own emotional, physical health.
Well, we've got about 1 minute left, and I want to close maybe with you, Susan. But before that, my final question, I just want to thank both of you for your thoughtfulness and our audience for these great questions. So based on what you were just saying, Susan, about, the amount of time someone is caring for somebody, what would you want care partners to know for someone who might have a long road ahead of them, about what options are ahead of them as the health of their loved ones decline? And we have about 30 seconds here.
So I think probably my key takeaways would be that there are options. They're going to look different for everybody, but there are always options. And I think many families and individuals go it alone for far too long. So lean into experts, lean into, your Dr. Mosqueda's of the world, the Alzheimer's Association, whether it's your lawyer. Also, informal supports are really important as well. That neighbor that takes in your trash cans. But I have never, ever heard anyone say, I reached out for support too soon. What we want is individuals to figure out how to link into what supportive services, informal, formal, that work for them earlier, now, before it's too late.
Thank you. So much wisdom in this conversation. I really appreciate it. Our time together is over. Thank you so much and have a lovely day.
Thanks for listening. Be sure to subscribe to our podcast and visit us at podcast.usc.edu.